Hi, welcome to Dr Hennessy's podcast, part 2. So, do you find the products have improved? So, I know you're saying it's specifically for an area, say fine lines here. The product's better as well, although it's thinner. You'll use it in a different way.
I guess so. Well, okay, using it in a different way is probably the main thing. I think our knowledge of anatomy and how the filler works has changed. On an interesting note, what actually we now know is that filler often lasts longer than we used to think it was. We still sort of say approximately 9 to 12 months with people, but some people are finding it's a couple of years. And we're only learning that because it takes time to realize that the filler is lasting that long. It's not a bad thing. It's bad if you don't want it there, but you can always dissolve it if you didn't want it there. But these overfilled faces walking around and then wondering why it's not going after 2 years is maybe it's the quantity of the filler and it's just your body's just not breaking it down. But again, sticking within the natural realms, the filler still tends to break down and people come back for little top ups and stuff after 12 months. So it's more the fact that I think not necessarily the fillers have drastically changed because they're still mainly based on hyaluronic acid, which is a natural product in our skin anyway, isn't it?
Yeah.
You know that. And but I think our knowledge of the anatomy where we put it, like back in my day, you never
Your
used to do.
day's my day, so be
Yeah.
careful.
We never used to do cheeks. We'd literally fill everything. We'd fill nose to mouth lines. We still fill. We had this conversation.
Yeah, I like nose to mouth
Yes,
lines.
filled.
Why wouldn't you do it now? Why
So
don't you?
we've realised, and okay, a lot of studies have come about purely because of aesthetic medicine. One of the studies was the fat pads in the face, we realise disintegrate as we age. So you lose volume. So often that means you then get these lines here because the skin drops. But if you then just come along and fill those lines, you get a very false look. I call it the sort of the gibbon look, the chimpanzee look, because you're all full here and not here. So you're suddenly disguising the lines, but you're not correcting the cause. The cause of those lines is because you've lost the cheek volume here. So you fill here, I'm exaggerating, you're not making it look like that, but you fill here first of all,
Yeah.
and then you can have a little bit there.
So you can.
You
It's
still can,
just
but you would only fill here once that's corrected. So you start there and then do those number two. You don't do that number one if they have flat cheeks because you're heavy in the wrong place then.
okay. So you said to me as well that this area is slightly dangerous as
Yeah.
well. So are
Okay.
you just filling the tail ends, or do you go superficially here, or what?
So the artery here, funnily enough, again, this has changed over the 20 odd years and we're learning. So it used to be when we started out, the artery was deep. Then they said the artery was superficial. And the latest study says it's either superficial, medium, or deep. Da-da.
Oh, is that
Try
a
and,
man who's
try and
decided
avoid
that? Yeah, it's
that.
covered it all.
Covered all bases. So the fact is, whenever you're doing an injection, you're always thinking there's an artery in your way. It's nice to know in some specific locations, like there's an artery down here, we know it's always on the bone 100% of the time, it's the facial artery. So if I'm injecting here, if I'm just in the skin and not deep, I'm safe. Safer, we will say safer. But the nose to mouth lines, you're not sure. So when I'm teaching it, I say to people, we can use cannulas, you can use needles. You keep moving so you're not actually injecting the artery. The risk comes if you inject a lot of filler in that artery. You can massively reduce that risk by constantly moving your needle so you're not putting a bolus, as we call it, a big lump of filler in that artery. So if you put your needle or cannula in and you just press the filler in your inner artery, you're going to bung up the artery basically, and your face needs arteries.
My
So
face needs filler.
yes.
So, so you do here.
Yeah, so you do there, absolutely. But as I say, do the cheeks first, do there, but you're mindful that it can be a little bit dangerous there. So you just take it easy, thinner filler, nice and slow, moving as you're doing the injections.
Thanks for watching us. If there's anything you would like us to cover or any other information, just leave it in the comments or message us and we will do it for you.